times of war, children are not only the most vulnerable, but also the most profoundly affected. EWTN Vatican journalist Valentina Di Donato recently traveled to Ukraine with the Order of Malta. She brings us a closer look at how the church is supporting those in need.
Maxim is not even 10 years old, and he has already experienced more than most adults. This is the third hospital where he is being treated, receiving dialysis treatment. The other two hospitals where he was being treated in the occupied regions of Ukraine were bombed. We are inside the St. Nicholas Hospital in Lviv, Ukraine. They are currently treating 315 children with serious war wounds.
Our experience with from beginning the war gave us hope and possibilities to treat another children from all Ukraine, almost from eastern part too, because many patients, many children, many families are relocated from that parts, and now we can more better help them than it was in the start.
And due to the weapons of war becoming more insidious, Dr. Shevchuk says the type of wounds he is treating on his little patients are now becoming more complex.
It was bombed almost this department where dialysis was performed, and one doctor died under this bombing, and many damaged doctors and patients.
What is his name?
Maxim.
Thank you. Dr. Shevchuk also says that he is seeing an increase in deformities of newborns, a phenomenon he tells us is more collateral damage from the war. According to a UNICEF report, more than 2,520 children have been killed or injured since February 2022. The true numbers are likely far higher, as these figures account only for casualties verified by the UN.
We think chronic stress during pregnancy perform growing of inborn defects, different defects, not only urinary system, it's with lung, cardiac system, neurology defects.
According to a recent UN human rights report, death, war injuries, and lasting family separation are among the traumatic events that have upended the lives of Ukraine's children in the 3 years since the Russian Federation launched its full-scale invasion. This is an orphanage outside of Kiev where children await adoption. The director tells us that there has been a dramatic increase in the number of children abandoned since the start of the war, as parents are killed or missing, and others feel they can't financially or psychologically care for their children. The director of the Kiev City Center for Social Support of Children and Families, Tetiana Lamar, tells me that there needs to be a happy oasis for these children. But even the orphanage can become a target.
Some of my employees were killed here because they stayed despite the occupation. There were cadavers thrown on the street. This was our reality. When we returned, we needed so much time to clean here. It's very hard to talk about this.
Russian soldiers came into the very playground and killed some of Tetiana's employees. The Order of Malta reconstructed the entire playground, allowing what was once the setting of the unthinkable into a place for new life and opportunity to grow. The war is a contrast of realities, the starkest and most harrowing sights amidst familiar normalcy. Igor is a boy who is playing with a golden retriever. But Igor stepped on a mine while playing outside in his town, which was occupied. He is now in the process of rehabilitation to prepare for a prosthetic leg so that he can pursue his dream of playing basketball.
I play basketball.
In Lviv, Ukraine, Valentina Di Donato for EWTN News Nightly.